Today, we're talking about spinal stenosis and orthobiologics. If you haven't heard these terms, I understand, but you deserve to learn more about it. Today, we're going to talk about both and give you some semblance of what's going on with each. When we think about spinal stenosis, it's someone who traditionally has issues with struggling with being able to walk and stand for a long period of time. Traditionally, they have this feeling and sensation of, man, I'm bent over. I hate having to sit all the time and I can't do the things I want to do. But many times society and sometimes their primary care doctors have told them that you're just getting older. This is what you're just going to have to deal with. And it's both frustrating and it's not empowering. So when we think about how to be able to kind of deal with this, we really need to understand what's the cause and how this actually is experienced. Traditionally, in the United States alone, more than 8 million people have spinal stenosis. That's roughly 1 in 20 people. And the number is consistently growing as our population ages. So one of the things that we want to understand is what causes spinal stenosis. And there's a number of different causes. They can be caused because there's a shift that's present in the spine. It can be due to there being a bulge of a disc that's present. It can be an increase in something that's called the ligamentum flavum. And we're going to talk about these type of things. And little tidbit, we're going to also give you some options about how you can actually impact this without needing spinal surgery or fusion. But at the end of the day, we got to have an understanding about where do we start. We think about this and the spine is squeezed and you have this nerve compression and docs tell you that you have to have a laminectomy and spinal fusion. And when most lay people hear this, they're like, well, clearly the doc's right. I have to be able to relieve the pressure on my spinal cord. Otherwise, I'm going to have a number of risks that are going to take place. And what could I do otherwise? I just don't have those different options. No one really tells me other than just to live with it and sit down. And I don't want to do that. But spinal surgery is not without its potential risk. There's risk and complications like infection. There can be issues with damage that can take place, and recovery can take months. Even with traditional physical therapy and lifestyle modification, 20% of patients will experience some form of complication after surgery. That's 1 in 5. And so when you think about it like that, and you have this consideration of saying, oh, I'm going to try this surgery to increase and improve what I feel, but at the end of the day, you end up actually not getting better, it's just disheartening. So that's where we talk about a new type of hope, a hope that's called orthobiologics. So orthobiologics are a cutting edge approach that uses your traditional parts of your body that are autologous treatments. And so what does that mean? It means it comes from you. And you can use things like PRP, which stands for platelet-rich plasma, stem cells, and growth factors to be able to stimulate the body's own mechanism of being able to regenerate tissue and improve the healing factors. So when we think about PRP, for example, it's a concentrated solution of platelets that allow for you to be able to place at a specific site, and that PRP then results in increasing the healing cascade that's present there. And that type of healing is huge. In addition, stem cells, which have been talked about for quite some time, have been sort of given this moniker of, oh, they can fix everything. They can fix a number of different things, and the mechanisms behind how they work is not only do they bring healing there, they act themselves as part of the building blocks. And you can acquire stem cells from a couple different areas, but traditionally it's the iliac crest, which are mesenchymal stem cells, or you can acquire it from adipose, where you actually have a little mini liposuction that's done, and you use those adipocytes or fat cells to be placed in different areas. And so what can that do? It can be able to help the body be able to regenerate cartilage, bone, and even some components of what we think might be nerve orientation and nerve relations on how those things are impacted. So when we think about how do we compare the aspect of orthobiologics, traditional spine surgery, number one, it's minimally invasive. There's no large incisions, which means there's less likelihood of an infection, and it's a quicker recovery time. People are able to get back to their normal activities and get back to doing the things that you want to be able to do. As opposed to spinal surgery, even if you're doing a fusion, for most surgeons are going to make an incision through large amount of muscle, which then has to heal in addition to the area that's deeper. And that area that has to heal takes normally a number of months, not just a number of weeks. In addition, All these things, as mentioned before, that you would do with surgery can result in infection, it can result in scarring, and that scar tissue can make things be worse, which results in the need for additional surgery going forward, which no one really wants. And then finally, we talk about cost effectiveness. Most of the time, when we think about orthobiologics, they're not covered by insurance. And so people will say, well, then I'll take the insurance option of doing, spinal surgery. But let's take this in a different manner and say, if you have a complication, then normally what's going to happen, although your insurance will cover it, it will take you off of time with being able to spend with your family. It'll take you away from being able to work. And it's normally going to increase that healing time frame from longer to months to sometimes almost as long as a year, if not longer. And when you really think about a potential option that doesn't really have a lot of downsides, besides it may have a slightly higher cost in the short term, but actually cost you less in the long term, it may be something to consider, particularly if you're talking about further hospitalization, extended care, and it is something to consider. So there's been numerous patients that have had treatments that have been done into the area in and around the back, which is one of the areas that our clinic, Cutting Edge Health, actually specializes in, when patients have been able to say, you know what, it's been the first time that I've been able to walk pain-free in quite some time. And they've been able to sit comfortably for hours, which they weren't able to do before. Truth be told, orthobiologics is actually the future of spinal health. It's reshaping how we think about stenosis, how we think about disc bulges, how we think about arthritis. And while not every patient is a candidate for it, most patients are. And they really should be having this conversation with doctors who are knowledgeable. Traditionally, you talk to an orthopedic surgeon or a neurosurgeon, and they're going to tell you, oh, it's a bunch of bunk. But I can almost guarantee you the number of actual orthobiologic procedures that those doctors have done is probably zero. They don't know it. They haven't experienced. They probably even haven't witnessed it as a student, as a trainee, as a fellow, or even as an attending. So they're speaking about something that they really don't have any idea about. But number two is the upside about orthobiologics is even if it didn't work, it doesn't make you worse. And the success rate for many conditions can be as high as 80 to 90%. So when we think about being able to get that tissue back to its normal function, it puts you in a place that changes the game. And truthfully, it should be in the near future the standard for treatment, including spinal stenosis, and it can help give relief to millions of people so that they're not needing invasive spine surgery. If you found this video helpful, please hit the like button. If you want to learn about treatments that let you be empowered, let you be able to be your own health advocate, let you really be able to not just take what your doctors tell you at face value, but let you be able to direct your own care, hit the subscribe button. So that way you can be able to know your options, how to be able to live longer and better, and how to really be able to punch pain in the face, whether it's physical and mental, and get back to leading the life you deserve. Thank you so much for your time, and have a great day.